Good morning, team. I'm going to give you a report, kind of like a rundown on the patient in 1025 that I was called to see last night. This is a 72-year-old Caucasian female with history of arthritis, cataracts, depression, hypothyroidism, and anxiety. The patient was admitted on February the 17th with worsening thoracic pain. She did undergo a T1 through T3 laminectomy with wound exploration. Before that, let me give you a brief rundown about this patient up until this point. So this patient was initially here at the hospital January the 18th, where she had presented with severe thoracic back pain that was radiating to her right shoulder. During that admission, she was found to have methicillin susceptible Staphylococcus aureus bacteremia with right septic shoulder and a thoracic spine epidural abscess, which she underwent evacuation on January 19. At that time, she was treated with ANSEF, discharged to an LTAC for an 8-week course of ANSEF. The patient did return this time to the ER on the 17th with worsening thoracic pain, and like I said earlier, had a T1 to T3 laminectomy with a wound exploration. Her hospital course has been prolonged with progressive loss of bowel function and weakness and gait instability. She was also found to have pathologic fractures. So at this time, she status post T1 to T3 corpectomy with posterior fusion in the C5 and C9. Currently, she's in a rehabilitation unit for rehab. Was called last night to see this patient because after the dose of IV vancomycin that she received, she developed rash on her face and her trunk, and blood pressure dropped into the 70s. Patient complained of chest tightness and difficulty breathing. Past medical history of this patient is anxiety, depression, hypothyroidism, and cataracts. Her past surgical history in 2019, early part of this year in January, she had an arthroscopy in her right shoulder. She had an incision and draining of a left hand abscess. She also had an eye surgery, and she had a left lobectomy using the VATS technique. In 2018, she had cataract surgery both with IOL implantation both in her right and her left eye. On her drug allergies, it stated that she has no known drug allergies. Patient she just currently takes Wellbutrin, 150 milligrams daily. She takes ANSEF 2 grams every 8 hours, and ID the dose of Vanc that was given was the first dose that infectious disease had just ordered, a gram of vancomycin IV. She also takes Lovenox 40 milligrams sub-Q daily. She takes a lactobacillus. She takes amothyroid for her hypothyroidism 45 milligrams daily. She takes Effexor 75 milligrams daily. She's also on vitamin B12 1,000 mics daily and vitamin D3 4,000 units. So I responded to this patient's bedside when being called. On a review of system, the patient is denied she had no fevers. She had a little bit of chills and fatigue, and she was positive for weight loss. There was no vision changes, no ear aches, no nasal congestion, no sore throat, and pertinent positives on her review of system. And respiratory wise, she had no coughing. She did report the shortness of difficulty breathing, and she had a little bit of wheezing when I listened. Oh, that would be on the physical assessment. I take that back. Pertinent positive on the review of system, just positive for shortness of breath, positive for hypotension. On arrival, blood pressure was 76/58. Positive for chest pain and palpitation. no nausea, no vomiting, no diarrhea, no abdominal pain, positive for anxiety, no headache, no numbness, no tingling, positive for bilateral lower extremity weakness and dizziness. On physical exam, the patient's blood pressure was 76/58. I said she was a little on the tachy side. Blood pressure, heart rate was in the 110s, 115. She had no fever. Temps was 98.0. She was also tachypnic, breathing about 24 per minute. And on arrival, patient was already on a non-rebreather max, so she was saturating at 96-98% on the non-rebreather max. She was awake, alert, and oriented. Her speech was clear. Sensations were intact. Her pupils were equal and reactive to light and accommodation. On her face, she had redness in her face, her trunk, and the neck and the trunk area, and a little bit of rash. So she's also had some positive tongue swelling, but her mucous membranes were moist and pink. Her neck was supple, trachea was midline. Patient's chest breath sounds were clear bilaterally on the upper lobe. She had a little bit of wheezing on her lower lobes. She was tachypnic, breathing about 24 per minute, with I want to say little labored, not significantly. She was tachy in the 115s, the 120s, but no JVD, no murmurs, and no rubs. Her abdomen was soft, non-tender. Bowel sounds were present in all 4 quadrants. Her lower extremities, she did report bilateral lower extremity weakness and gait instability, which that's why she's in the rehab unit. She also had some weakness in her upper extremities, but patient verbalized that was due to the thoracic back pain. No edema, no clubbing. There was bricks capillary refill. On her skin, we noted red rash on the face, the trunk, bilateral palms, and neck, and her neck. So upon arrival, we did order some labs. We wanted to start CBC, a BMP, and a CMP. We also did order a BNP and ABG for this patient. And the 3 differentials for this case that I came up with was allergic reaction to vancomycin was the top one. My second differential was hypotension, and the third differential was I want to say probably low risk for PE. So on the first differential, which is the allergic reaction to vancomycin, we did the vanc was already stopped, so I gave her 25 milligrams IV Benadryl, 50 milligrams Solokotev, 20 milligrams Pepcid, and 0.1 milligrams of Epi. I did speak with infectious disease, and recommendation was to give a second dose of 50 milligrams of Solokotev. So patient did get a total of 100 milligrams of Solokotev, and discontinue the IV vancomycin from the patient's profile. Hypotension, I gave bolus the patient 1,000 cc normal saline, which I saw some response. Blood pressure systolic came up to the 90s. Looking at the patient's trend, patient's blood pressure runs in the low 100s, her systolic. So I was fine with the 90. And possible PE, ruled that out. Patient is already on Lovenox, anticoagulant. Yeah, she's a post surgery patient that's not really moving well, but she's already on Lovenox. So we're just gonna, I talked to the attendant, I gave a call to the attendant, which he just wanted us to watch the patient. There was nothing else that we did for the PE, but the labs that we ordered, which were remarkable. Her ABGs was fine. Her EKG just showed sinus tach. There was no changes in her ST segment or anything. It was just sinus tach, and her electrolytes, which the only was potassium was a little on the low side, 3.1. Patient is already getting 40 milliequivalent of potassium daily. So at this point, the PE diagnosis differential, we would just watch the patient at this point. And that concludes on the report on the patient in 1025, and thank you all.